This is Going Under. Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh.
And I'm Dr. Brian Schmutzler. Our show is sponsored by Butterfly Network. When it comes to successful ultrasound-guided procedures, precision is everything. That's why IQ3, Butterfly's handheld POCUS device, contains advanced features to support procedural success. With Butterfly's needle out of plane preset, you can visualize the needle tip within 1 millimeter after insertion. Butterfly's biplane imaging, the only multiplane imaging in a handheld ultrasound, lets you see both short and long axis views simultaneously in real time. And NeedleViz enhances your ability to track the needle in plane from entry point to the region of interest. Butterfly IQ3 also delivers image quality similar to cart-based POCUS systems at 1/10 the price. And unlike a cart, you can carry it in your pocket conveniently, using it wherever you want, when you want. So whether you're inserting IVs, performing regional anesthesia, conducting cardiac assessments, gastric ultrasound evaluations, lung ultrasounds, or anything in between, the Butterfly IQ3 is the perfect probe for your practice. Visit store.butterflynetwork.com to claim a soft case with the purchase of IQ3. Use code BRIAN25 at checkout. Terms apply.
And a shout out to Aspire.
Oh, yes.
Healthy energy.
That's right. It's one of the only energy drinks that doesn't give me a headache. So it's like 80 milligrams of caffeine. It's great.
Love it. All right. Welcome to another edition of Going Under Anesthesia Answered with Dr. Brian Schmutzler. In today's podcast, we're talking all about something that I have never done before.
That's right.
Acupuncture.
Acupuncture, correct.
I want to know all about this,
You should
Brian.
come over and do it.
Where do you get it done?
Well, I mean, I do acupuncture.
Wait. Hold time out.
You didn't know I did acupuncture?
No.
Oh, wow.
All this time we've been friends. And
that's right.
Little did I know that you do acupuncture.
I got a whole kit in my basement, yeah.
So, first of all, for those of us who don't know, which I really don't know a lot about acupuncture, it probably goes back to ancient Chinese civilizations.
It does, yes.
Okay.
Yes.
So that's all I know. Thousands of years. That's what is acupuncture and how did it evolve into modern day?
Sure. So acupuncture is the use of needles at specific points on the body called acupressure points or acupuncture points that sort of equate, at least in the traditional Chinese medicine, to meridians or areas of energy flow throughout the body. Now, I'm more of a sort of modern acupuncturist, more of a like neurobiological acupuncturist. And so for me, it's not as much about, changing the meridians and the flow of energy and that sort of stuff. It's more about the neurobiology of it. And so if you look at all the studies on acupuncture, there are certainly release of hormones and release of endorphins and all that sort of stuff when you do acupuncture. And so what I've done, and so let me give you a little bit of background on why I got trained in acupuncture. Yeah. I had initially thought I wanted to do chronic pain as my career, not just anesthesia, but go in and do chronic pain, and in particular, pediatric chronic pain. So I did a rotation at Riley Hospital in Indianapolis with a couple of pediatric chronic pain anesthesiologists and chronic pain specialists, and they both were trained in acupuncture by a guy named Joe Helms, who has a whole acupuncture system. He's a physician himself. He's a family practice doc. So went out, got trained when I was in residency. And really what I found was most of my practice was pain, treatment for pain. I did a little bit of addiction medicine, but mostly pain. And so if you look at the studies of acupuncture, what's really happening? I mean, the scientific studies show the release of endorphins. So those are like the chemicals in your body that make you feel better or feel good, almost like your natural painkillers. You've also got release of several hormones, and then you've got reduction of inflammation in the body. All that happens with acupuncture. In fact, when I was a resident, I also was part of a study with one of these guys who did acupuncture, looking at the changes in gastric pH when you did acupuncture on kids who were having scopes, EGDs, for acid reflux and that sort of stuff. And so we had a pretty good result in terms of decrease in gastric pH. So certainly acupuncture was doing something there as well. So I got trained, and then I started doing it when I was a resident, and then also after I finished residency. And really what we saw for the majority of patients, you got about 50, 60, 70, 80% pain relief. And, mostly musculoskeletal pain, sometimes more nerve type pain. And I mean, side effects are basically nothing. And so when you're talking about patients who are taking opioids or taking medicines like ibuprofen, which can cause problems with the stomach and the kidneys,
Right.
Tylenol, which can cause problems with the liver. Acupuncture has really no side effects. The acupuncture needles themselves are tiny. They're like 40 or 42 gauge needles, so that means really, really small. Like your average IV is a maybe 20 gauge needle. So the larger,
That's bigger,
right? The bigger the gauge, the smaller the needle is the way they calculate it. So yeah, I mean it's been great. Treated a lot of chronic pain, treated a lot of addiction, particularly smoking. There's some auricular or ear acupuncture that seems to help with smoking. So did a lot of that in Indianapolis before I came up here. I've done a little bit up here, but really just acupuncture is really a great process for helping with pain and all kinds of stuff.
So in terms of invasive, how invasive is acupuncture? How long does it take you to recover from the acupuncture procedure?
Not very invasive at all. Again, really, really small needles. We hook them up to electricity to kind of mimic what you would do with like twiddling the needles. Invasiveness is minimal. On a scale of 1 to 10, maybe a 2. It is a needle in your body, but tiny, tiny needle. In terms of recovery, usually what I would tell people is the day that you have acupuncture, don't go out and like run a marathon or anything. Rest a little bit. A lot of times you'll feel those endorphins get released. You feel really good right afterwards. You want to go do stuff. Just go home, take a nap. But overall, very, very low risk. Potential benefit. It's really something that a lot of people I think could benefit from.
Do you? I've seen some of the blocks that you do.
Yeah.
Do you use some of those?
Nah. The acupuncture stuff.
You don't use any of that during the blocks?
No, I use an ultrasound like a butterfly IQ3.
Right.
Perfect. Perfect timing. I use an ultrasound to do regional nerve blocks. I don't do that for acupuncture. It's all anatomic based, so you kind of feel, for instance, the PC6 point is one of the most common points for nausea, which actually I did a ton for Alicia when she was pregnant. She got super nauseous. So I would do acupuncture, acupressure with the stimulation in her PC6 to help with the nausea. It helped her quite a bit. I've actually started doing it to one of my sons who has migraines. Just doing, again, some of the acupuncture points. He doesn't like the needles because he's younger, but we'll just do acupressure with the stimulation. Seems to help with his headaches.
Does it really?
Yeah.
So what is the, why aren't, I guess it's always been this kind of foreign thing, right? Like where, acupuncture is just kind of this, I don't know.
Yeah. So
why isn't it mainstream?
Well, so I'll give you a little history on acupuncture. It really wasn't practiced in the United States until the 70s.
Really?
When, somebody in Richard Nixon's administration went over to China and I think they had like I can't remember if it was a gallbladder or an appendix issue, and they had acupuncture for that, for the anesthetic. I think they had some other stuff with it, but really they had the acupuncture for the anesthetic and had a good outcome. And so,
interesting.
And so a lot that got publicized and came back to the United States. I think that there are some issues with people promising that acupuncture can do a lot more than it actually can. I'm very cautious to say like, hey, this is just another tool in our toolbox. I'm not going to fix your slip disc in your back, but I might give you some pain relief.
Right.
And so I think a lot of people, not necessarily people in medicine, but sort of people in other realms, are using acupuncture for things that it probably isn't as effective for and are over-promising and under-delivering.
Got it.
So that's maybe why it hasn't caught on as much. It's also not really covered by insurance, so you're talking out of pocket, and it's needles, so it's not the most pleasant thing in the world. The needles don't necessarily hurt, but they don't feel great. It's not like getting a massage where you're like, oh, that feels nice. It's not.
Is this like similar to like the cupping things that you do, or is that completely different?
So cupping is a part of the whole traditional Chinese
Eastern medicine
thing.
right?
Yeah, that and gua sha, which is scraping, where you take the edge of a Chinese soup spoon and kind of move it down and get some of the knots out. So that's all kind of part of the same traditional Chinese medicine type stuff. I've done all that stuff. I was trained in cupping. I was trained in scraping or gua sha. So
that's interesting.
Put it all together, and again, I focused 95% of what I did on chronic pain, and so it's a measurable thing. Hey, my pain was a 10, now it's a 3. Great, it worked. As opposed to some of the other things that you can't really
who is this for? Like, who is acupuncture for? Anybody?
Really, anybody. Yeah, there's really no age limit to it. They do it to animals. I guess like dogs and horses really like acupuncture. Yeah, I mean,
interesting.
Again, I don't want to overpromise,
Yeah.
right? Acupuncture is not the panacea. It's not going to fix every problem that you have. You're not
Right.
going to be like, oh, I had acupuncture once and I'm fixed. But I think it's another tool in the toolbox to try to help with chronic pain or chronic diseases. And there's no side effects. So again, if you can afford it, why not give it a try?
How much is it usually for acupuncture?
Well, that just sort of depends. I mean, I obviously when I'm doing it to friends and family, I'm not charging you. I think probably the average acupuncturist in Indiana charges about $120 a session.
Okay.
I've seen it as low as 85. I've seen it as high as 300 or 400.
Yeah.
The fertility guys have an acupuncturist down in Indianapolis, at least that I know of, and he charges a lot of money for fertility. It's really good for fertility as well, apparently. I never really did the fertility treatments, but so it just depends.
Yeah.
I'd say,
I'd be willing to be a guinea pig.
All right. I should have brought some needles.
I
with
know.
me. I
We
didn't
could
bring
get
any
it on
needles with me.
camera and can
Yeah.
include it in the podcast.
We can do some reels, yeah, for sure.
That would be
sure.
be interesting. I'm not a needle guy.
No,
You know this by now.
yeah, I know that it's not terrible though. You hardly feel it.
And what are the pressure points? So what are the main points that you focus on?
So they all go down meridians that are kind of based on organs, right? So you've got your gallbladder meridian, you've got your kidney meridian, you've got your PC6 is like pericardial meridian, and so they're all. Man, I'm sorry, Dr. Helms. I don't remember how many there are. I think there's 12. But I've done acupuncture like where I put a needle like in
geez.
somebody's duct right here for stuff.
In the eye.
Yeah. So I mean, it's interesting. It's interesting. I had a lot of success with SI joint pain.
Okay.
Taking a needle and putting it in the SI joint, which you can feel in most people. Put it in the SI joint. It seems to help.
Ugh.
Yeah. The eye thing bothered me a little bit.
Yeah,
Just
buddy. I don't know.
Putting it in somebody's duct there bothered me a bit.
I don't know.
Yeah.
Well, this is going under Anesthesia Answered. It's a short one.
Yeah.
But we just wanted to touch on the topic
Yeah.
of acupuncture, and I learned something new today. I did not know that you do acupuncture.
So if you want to look up, I was taught by somebody who's part of the American Academy of Medical Acupuncture, so AAMA,
Okay.
American Academy of Medical Acupuncture. So look up their website if you're looking for an acupuncturist who is trained in this sort of neurobiological, way of acupuncture. And yeah, we'll talk more about it. We'll do some acupuncture on you. Oh, do you have any ailments? You just want to just try?
Well, I mean, my ailments are usually my back,
Okay. Yeah, we can do some back stuff.
like my lower back.
Yeah.
I actually do have an ailment.
Elbow?
Well, I've as you know, I hold a camera basically every day, 24/7,
yeah.
and especially during the playoff run with Notre Dame, my tendon right here that connects to the elbow joint,
Yeah.
like right down here,
Yeah.
has been inflamed.
You got a little, what is it?
I tennis elbow. I used to have
think
tennis elbow,
yeah.
but this is more of an extension down the arm, so I can barely grab things.
We can take a shot at it with acupuncture.
There we go. Miraculously healed. I love it. No, we're not overpromising.
Not miraculously healed. Symptomatic treatment, symptomatic relief.
I love it.
Yeah.
That's awesome. All right. Well, what was the website again, or the
American Academy of Medical Acupuncture.
Awesome. This is going under Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We'll catch you in the next one.